when the world has got you down. And
Alzheimer's sucks. It's an equal opportunity disease that chips away at everything we hold dear. And to date, there's no cure. So until there is, we continue to fight with the most powerful tool in our arsenal, love. This is Love Conquers Alz, a real and really positive podcast that takes a deep dive into everything Alzheimer's, the good, the bad, and everything in between. And now, here are your hosts, Susie Singer-Carter and me, Don Priess.
Hi, it's Susie Singer-Carter.
And I'm Don Priess, and this is Love Conquers Alz. Hello, Susan.
Good morning. Good
How are
afternoon,
you?
good evening, whatever
Good,
it
good,
is.
whatever it
Every
is.
day
It's morning. It's definitely
morning. It's morning for me because I don't sleep ever. It's like,
Yeah.
this is it. So it just feels like it's morning.
It's
That's
always
okay.
morning.
That's okay.
Yeah.
I've got me caffeine and I'm ready to go.
Yeah. Busy week.
It's been a busy week. Still working on No Country for Old People a lot, which is our documentary for long-term care reform, which is incredibly necessary. So if you haven't, please head on over to the National Consumer Voice website. There's a dedicated page for us to donate to support this film. It's really important. We have an amazing. We've aggregated so many incredible voices in this community of advocates, like dedicated advocates, and I'm really proud of it. And I think we have a really good chance at making some movement, at least activating it and activating a bigger movement that we need. So we can really use your help. So please do that. And I'll also
100%
have it
tax deductible.
Yep.
100%.
and I'll put all the information in the
good
notes.
for us, good for you.
Yeah. And
Absolutely.
so on a flimsy note, where are you going this weekend, Dawn?
I'm actually
leaving me to do all the work.
Oh my God, I'm heading out to Palm Springs immediately after this. I'm going to be there for all of about 24 hours. That's gonna be it, and then I'm coming back. Yeah.
Wow.
I have a couple friends in from Chicago. I haven't seen them since before COVID.
That's a
And,
vacation.
they're out
That's
there.
a vacay.
Yeah, it's a big vacay. So I'll
Yeah,
get there.
in
I'll get
production
there
life, that's a
1:30.
vacay.
Yeah. So, and then I got to rush back Sunday night because my other project I'm working on, my Jack Warner documentary, we're shooting this week. My producer's in from New York, and we're going to be gallivanting
fancy.
around shooting, editing. I am very fancy.
You're
I mean,
fancy.
it's what I do.
You're like,
Fanciness is my middle name.
yeah.
It's not, but no, it's so I'm looking forward to
He's a
that.
big producer, editor now.
I really am. But I can't wait. Once we finish that, rolling right into No Country for Old People, it's going to be crazy.
Oh my gosh,
so
it's
I'm
a
taking
beast.
advantage of this 36-hour vacation.
Because I will be at you with a whip, just like. No sleeping. Let's get this done.
No
we
sleeping.
have
No
to get
sleeping
this done.
for old people.
No sleeping for old people. Don's actually only 25. Look what happened.
Exactly. Yeah.
His hair is now gray.
I know.
Sorry.
It hurts. It
Sorry.
hurts, but it's okay. It's okay. Yeah, whatever. That's fine.
It's for a good cause.
It's fine. It is. It is.
We have a
So
super cool
I
guest.
think-
I have a good. I have
Yeah,
a
we
really
do.
nice
I
guest.
can't wait.
We do. Yes. Look at us. Just blah, blah, blah.
We do. Ba, 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 ba.
Okay.
Should I tell them all about
Yes.
our fabulous
Please
guest?
do.
Okay. Are we ready? Okay, Here we
Yes.
go. Dr. Buffy Lloyd-Krejci is one of the foremost authorities on infection prevention and control in nursing homes and long-term care facilities. She's the author of Broken, How the Global Pandemic Uncovered a Nursing Home Industry in Need of Repair and the Heroic Staff Fighting for Change. Her practice, IPC Well, is devoted to mitigating infectious diseases and inappropriate antibiotic prescribing in all healthcare settings to reduce adverse events, infections, antibiotic resistance, readmissions, and death. Dr. Buffy consults with healthcare facilities across the United States and internationally with Doctors Without Borders. With more than 20 years of healthcare and public health experience, Dr. Buffy's data-driven approach is hands-on and collaborative. Using her experience with more than 200 nursing homes across the U.S., she works tirelessly to combat the estimated 1 to 3 million infections, leading to more than 380,000 deaths every year in the nursing home industry. She's on a mission to change the way our elders are treated and given care. I could go on and on. In fact, let's do that. Let's go on and meet the one, the only, Dr. Buffy Lloyd-Krejci. Hello, Dr.
Hello,
Hi,
Dr.
guys.
Buffy.
Hi,
I like to call you
thanks for
Dr.
having me
Buffy.
today.
Thank you
Yes,
for being
please
here.
do.
I love it. I love it.
Lloyd-Krejci is a little hard.
Yes.
Yeah. Especially when you forget, to say the entire name.
The
but
entire
it's
name,
easy.
yes. That's okay. It was edited out.
Yes.
So unprofessional,
Indeed.
Don. How are you? I know you've been working really hard writing a new book.
Yes, I am. So it's, we're talking still about Broken because this Broken just launched last year, April of 2022, and I didn't really take a breath. I jumped right into.
I think it's
You got it
upside
up.
down.
It's upside down. Look at this.
What are you,
I'm
Trump?
tired. Okay, let me do that again. Take two.
Let's try it again.
She's showing how broken it is.
I am
There it is.
not it, me there. It's really a good
No.
book. I had my co-producer just finished reading it too, and she's a faster reader than me. She was like, "I'm done." It's very impactful and packed full of things. Incredible. A lot of work went into that book.
Yeah.
A lot of work.
Yeah, I was just really wanting to capture my experience during the pandemic with what I was seeing and really advocate for change. I mean, that's my whole point of doing this. And then really writing my second book, it's more geared towards the consumer and really how to navigate this system because like yourself, I mean, people have loved ones in long-term care or senior care now, or they're entering senior care, and we can't wait. I mean, we need to actively work on fixing the system, but what about today? So
Exactly.
I'm having a lot more fun writing the second book because it's not as traumatic, and it's really solution driven as far as finding some of these really great practices. So that's been pretty cool.
Well, that actually is that puts a little lift in my step because I am also like you were in Broken. I am in it. I am in the trenches right now,
Yeah.
and it feels very heavy. The conversation is heavy, and yeah, the system does need to change. But the thing that really, like to reiterate what you said, that haunts me is that right now, every day, every minute, somebody's suffering. And so
Right.
the longer it stays the way it is, the more people are affected by it. And so we do need some solutions that are, Band-Aid solutions, as it were, because there is a huge, bigger problem, but we need to be able to address the things that we can, at least, right?
Yeah.
So, well, before we get into what those are, because I know you have a lot of thoughts on that, right? But just if you could truncate a little bit of your experience that motivated the book Broken.
Yeah, I mean, so I've worked in healthcare really since I was 17, so it's now over 30 years. I just keep 20 years on there because that doesn't make me so old, but
Ageism, see, there it is.
Yeah.
There
And
it
30
is.
years is over 20 years. So
There
so
you
it's
go.
fine.
There
Yeah.
you go. But I've always had a passion for, helping in healthcare. And both my grandparents actually died in nursing homes when I was only 19, and I navigated that system back then. For me, I was really grateful that my grandparents had a safe place as far as what I knew to be a safe place, and I still would maintain that they did have a safe place. And there were a lot of things that obviously could have been different. Now I understand the industry more, but I I've had my family, but I've always, kind of stayed in working in healthcare. And in 2015, I started working on a national pilot study with CDC and Centers for Medicare and Medicaid. And I started working. This is really what cracked me open to the long-term care industry and seeing the disproportionate number of infections that were occurring. And I kind of looked around and I'm like, who's working on this? There wasn't a whole lot of action. I mean, we were doing this pilot study, but actually, after this study was done, nationally, it all kind of went away. And I just was like, I'm not done. So in 2017, I launched out. I started my own company. And I said, I'm going to help these nursing homes. I'm going to really do everything I can. I had no idea what I was doing. I was very naive and had no idea what an uphill battle I was
Sometimes
facing.
you need
And
to be
then-
naive, Buffy, right?
Yeah,
Sometimes that
yeah, right.
naivete
Otherwise,
helps.
you wouldn't do it.
You wouldn't do it. I say
Yeah,
that all the
you
time
wouldn't do
because
it. Yeah.
that's how I feel. Before you move on, what kind of things were you seeing in 2015? So give us just a sense of what it looked like then, and then as you progress and tell us
Yeah.
more.
So it was just to give everybody an understanding, infection control practices were not even really strong at that time. I mean, we're talking 8 years ago. It wasn't that long ago. And because they were really focused, when I say they, I mean like public health and CMS focused on other priorities like falls and antipsychotic use and some other areas. So, here you have this industry that has these infections, but it's almost considered just normal. It's just normal for the residents to have UTIs or pressure ulcers or
Right.
pneumonia or influenza or scabies. Like, it's just part of their world. And there just wasn't this heightened sense of urgency to any of it. So working with the healthcare setting and working with healthcare professionals, the overwhelming response, which is very similar to today, is we just don't have time to focus on this. We have
It comes with the
all
territory.
these, yeah. There's just, in long-term care, it's kind of whack-a-mole, and I talk about this in my book. It's like there's.
I say that all the
It's like
time.
you're just, you're dealing with this, but there's such a lack of prevention within this industry.
Reaction,
and I can see
right?
why. Well, it's reaction because they are so short-staffed. They don't have what they need very often. And so it has to be reactive.
Right.
Like, they don't have in place. Now, when I say they, it's the majority of what I see. I have seen some phenomenal long-term care facilities that really have changed their culture and work on implementing prevention practices. And that's what I would love to spread across the country, is that attitude and to know it's successful. But boy, to get there, there's so many layers of other things that we have to deal with. So it's not just so simple, it's just
But it shows it can be done. It shows it can,
does.
because everyone thinks it's such a big problem that it's too big. You can't do anything about it, but it can be done. We have models that show that it can be done. And so is it just money as to why it's not being done?
A lot of it is the and I haven't gone down this rabbit hole, and I quite frankly don't want to, because I know what I'll see, but I'm sure you guys have maybe. But there is a lot of corrupt dealings, and I do mention that in my book, and so it's like, for, let's say, a corporation to profit hundreds of millions of dollars, and that goes into the shareholders' pockets.
Right.
Not sure that should ever be happening when we're talking about our frontline staff can't even make a living wage, and they're the ones caring for our loved ones. So, like, we have to look at all of that, and we have to have the accountability of where these funds are going, because it's, we can't simply say we need more funding, because then on the other side, you look at it, you're like, well, we provide you more funding. Where's
Right.
it going? Is it going
right.
where it's supposed to go? Or is it going into people, the shareholders' pockets? Like, what are we doing?
That is it. You're right.
Yeah.
The facilities
Follow
that
the
I
money.
see, the facilities that I see that are very successful, and I would say I would feel safe having my loved one here, are the ones that put everything back into the facilities.
Right.
They're not the ones that are just trying to squeeze every dollar, and like they're investing in infection prevention practices. They're investing in the staff. They're investing in education. So it is possible. It's just,
It is.
are we going to make that a priority?
And they
Exactly.
can, they can do both, meaning that they don't have to,
Yes.
I mean, and I'm saying how much anyone should make, but if, let's say they just made tens of millions instead of hundreds of millions,
Right.
it's fine. We know it's a business and we understand that,
Right.
because if not, and so everyone could still make, a very nice amount of money, and there'd still be plenty left over to actually do what they're there to do.
Right.
And because right now that it's just it's greed, and
it is greed, and it's
that's,
also
that's the first step.
it's a lack of regulation and a lack of oversight because there hasn't been attention put on it. The infrastructure was made, and then it's implemented, and then it's like, here, now it's going to work. Well, of course, if there's billions of dollars available, you're going to get nefarious actors to want to take advantage of it, and that's just human nature. That happens in every business, and and that's just it. And so, we've sort of, when I say we, as a community, as a society, we haven't really paid attention to that, and we assume that it's being handled properly, because we pay into that system. We are the providers of that system, but it's not. It's not, and that's why you're.
So what people don't realize is that there is oversight, and if any, and so there is oversight, and there's almost over-regulation to the point where it's not effective. So the nursing home industry is actually the second most regulated industry in this country, next to nuclear power. But the problem is when things happen, the regs get bigger and bigger and bigger and bigger, which make it actually, it's almost like they just keep throwing it on top of it. So it makes it impossible to really understand it's just too convoluted. It's not, we need to strip it down and actually have a set, the regulations that aren't thousands and thousands of pages long,
right,
so that people truly understand. And the regulators that come into the facilities, because they're undertrained. I mean, I talk about that in my book. That's a broken system as well. They are undertrained. They don't even necessarily have the expertise. They're given a certain amount of time to really evaluate the facilities. Mm-hmm. It's more of a bullying system. It's not really like this collaborative approach. So it's like kind of this gotcha mentality. So it's not like, it's the surveyors are doing what they can. Let's say they have 6 hours. They're going to pick apart all the really easy stuff to see. The
low-hanging
nitpicky
fruit,
things.
yeah. Mm-hmm.
Right, because that's all the time they have.
Right.
So that whole regulatory reform needs to change as well.
Yeah.
And I argue that it needs to, that needs a whole overhauling, because like you mentioned, we've added layer and layer and layer and layer and layer over the years. And well, there may be stuff that's in there from 50 years ago that we're not doing anymore. You know what I mean?
It's not relevant. It's not relevant. Right.
Right. So we have to really evaluate that. Yeah.
And Dr. Buffy, I think that at every layer of this system, like from the regulators who are, or the policy writers and the all of that, each department is just trying to complete what they have to do because they don't have the time to do a forensic look and say, let's really tear this apart, like cleaning out your closet, right? What don't we need anymore? What don't we wear? Let's throw it out, because you're right. It's and it becomes, at the end of the day, our front line are bearing the brunt of it. I know that. And so we are losing a lot of the dedicated,
yes,
and we're losing a lot of the skilled and the vocational frontliners, and we're getting people in just to fill the boxes and the spaces. That's unfortunate. So that compounds the issue. But I kind of want to circle back to what you do, because I think what you do is such a unique, profession. To go in and to identify infection, because infection is like it is the root of all evil for any of our elder families members, right?
Yeah. So what we actually do, I have a team of 3 other infection preventionists myself, and we're just really starting to make an impact, which I'm so grateful for, because we go into the nursing homes, we work with their staff. So what we're doing is I can't be in that building all the time. So I want to educate and equip the staff that are there so that when I leave, they know what they need to do. Now, the funding that we get typically is only for 1 visit. So how much good can you do with 1 visit? So we try to do everything we possibly can, and then we leave them with like a report with a toolkit, and we offer them a lot of free resources as well, so they can keep they can get as much information as possible. But also we have, and I'm very grateful for this, and it is through CMS. So it's just interesting because CMS is the regulator. They fund the quality improvement organizations, and that's who we're funded through. So we've got quality side and regulatory side. But we're funded to go in and help these nursing homes. And I'm really excited because we just got funding to support 30 nursing homes in Wisconsin, Michigan, and Minnesota, to work with them for a year. Like, we get to work with them for 1 year, and we get to come on site every 3 months. We get to work with them monthly. And what we're trying to do is we are working to implement best practices. We're helping to shift their perspective from this reaction to prevention. It's a lot easier to prevent than to try to mitigate and stop the outbreaks.
That's right.
And so it's really interesting, though. We have to start from the very, very, very basics. For example, I'm pulling some data that we did over the last year. And can you believe that still 50% of the buildings we go into do not have good access to alcohol-based hand rub? If we cannot have a proper way to conduct hand hygiene, which is the number 1 way that infections are spread is through our hands, like, that's where we start. Okay, fine. That's where we start, And so that's, right. We go in and we do like an environmental scan. Basically, we're talking to the housekeepers, because if you have housekeepers cleaning your toilets first and then going and cleaning your tray table, you're spreading all sorts of stuff all over the entire building. So we really get down to the basics. And what's exciting is as we get to work with the facilities over time, then we start to work on, the preventions of the UTIs and all the wounds, all the different types of potentially, pneumonia. We get to actually work with the designated infection preventionists, right, and the staff in working to truly prevent these practices. But it's not something that, if you have a culture that's been running, like, for example, I had a housekeeper, one of my infection preventionists was on site last week in Michigan, and she just told her the simple thing, which I've been telling you, is to clean the resident's room first, to not cross-contaminate. And she goes, I have been cleaning the resident restroom first for 25 years, and nobody has told me anything different.
Wow.
I mean, that's just something really basic we can start with.
Right.
So we have to start there.
And when we talk, circling back to, money, isn't prevention way cheaper than reaction? Don't the people who run these facilities realize, oh my gosh, I'd be making even more money if we just prevent all this stuff from happening? Or is it that that seems like common sense.
It is, but I think as humans, we're not the greatest at prevention. We're not the greatest at maintenance. Like, we know if we go and we get our oil changed in our car every 3,000 or 5,000 miles, that's going to help protect our engines. But does everybody do that? Or if we go to the dentist every 6 months, that's going to prevent us from having cavities, So yes, prevention actually does save money. It saves harms in the long run, but we're so deep into the trenches with reaction that you absolutely have to have dedicated leadership. And I'm talking the administrator and the director of nursing. You have to have those two roles absolutely dedicated to turning the ship around, or it won't happen. I mean, that I have just seen it building after building after building. We have to have leadership buy-in.
You have to. And It's interesting. Yesterday we were having a conversation with a lawyer who, this is his is he defends, for elder abuse, and it's really an exercise in futility at this time, right? So, but I asked him, he's a very lovely man, very, very driven by his heart, and he was talking about, at the very least, it's like he goes, it's talking about infection. It's like it's not a new concept, like. And he read a quote from Florence Nightingale that, back in the day, and I'm going to read it. She said, if a patient is cold, if a patient is feverish, if a patient is faint, if he's sick after taking food, if he has a bed sore, it's generally not the fault of the disease, but of the nursing. And this is, back in the day. So it's really in the basics of the tenet of being a caregiver, provider, or the front line is infection is number one, and that's why surgeons wash their hands so thoroughly and put on their gloves and the whole thing. You assume, I think, as the consumer, for lack of better, you assume, like you said, you assumed your grandparents were well, and I assumed my mom was well. Yeah. Always. I did. I thought I could sleep really well at night. But you assume that they know that. So it's kind of disheartening that they don't.
Well, I think they do. And here's the challenge. So I talk about this. I say, the problem is, one of the problems, let's say, and this is why we have so many really, really important and good healthcare professionals leaving the industry in just absolute record numbers. Mm-hmm. And so let's say you have a nurse and they love the elderly and they really feel it in their heart. They're called to work in this space, and mm-hmm. they, I have a infection preventionist that works with me that worked in a nursing home for 10 years, and she couldn't take it anymore and she had to leave. And here's what happened. So you're saving the best nurse in your class. You're skilled. You know what to do, and now you're given 30 patients or, the certified nursing assistants. Like, you cannot humanly deliver the quality of care if you have the workload that far exceeds what is humanly possible. And right. That happens. That is a big problem within our long-term care. The other thing is, we talked about, sometimes pulling profits, just being so I've had nurses tell me, Dr. Buffy, my corporate won't buy hand sanitizer. They won't buy gloves. They won't buy gowns. They won't buy sharps containers. Like, they want to do the right thing. But so often I describe it like they're in a straitjacket. They're trying to do what they can with
Agreed.
What they have to work with. And so what happens is that causes moral injury to them because they know that it's going against their own values. They know they can't deliver the quality of care that this resident deserves.
Exactly.
And they just can't continue doing it.
And this is what I was actually referring to, the administration, and because that's where it has to come from. So when they don't provide that, and they don't provide antibacterial, all that stuff, and they don't give that kind of training, then it's on them. And it's really their responsibility, because that's their job. The description of their job is to administrate it, and that's where we're failing, because they're being told what to do above that.
Right. And so the buildings that I see that are are more successful are, when you've got kind of more of that autonomy of that leadership, the administrator, the director of nursing, and they really do have the corporate support, or they're a single, just standalone facility. Where it starts to fall apart from what I've seen is when you have corporate leaders that are so far high above, they're so removed, they're not necessarily in it for the care. Look, this is a vocation of a calling, and if you don't really have that, I say you don't really belong in long-term care, because these are such precious human beings, and we can't just throw them away or treat them as if they're not valuable anymore, because they are. And but it's that, when I see, and again, I get to see all of it. So for me, it can be challenging, because I see the heroic staff, and that's what I write about in Broken. I see the heroic staff, including administrators, that are like, I could go and make a lot more money somewhere else, but I'm going to stay here because I care about this population.
Right.
But then on the other side, I see administrators that never leave the door of their office, and don't have any clues to what's happening. So I see the whole gamut of it. And for me, it's like, I just want to take these best practices that I'm seeing, and really say, like, this is possible, and let's shift these practices over. But and a good friend of mine, Dr. Michael Wasserman, he does a lot of great advocacy in California, and he will tell you time and time again, it has to come from the leadership. If we don't have the leadership buy-in.
And
how do we get to them? How do we make them understand? It seems so simple. If you could go to one facility, and despite all the regulations and the 50-year-old things that they're still doing it, and they're doing it right. And they've got to have, a bottom line that shows this works. It not only works on the human level, but it works financially. How is it so hard to get to these people and show, if you do it this way, it's actually better for you? Why doesn't this happen?
I think that from my observation, and like I said, for the second book I'm writing, and I'm interviewing, like these different best practices. Like, have you heard of the greenhouse model?
Yes.
So
spoke to Alan Power, who's very
much more of that community based, like where it's not just this big institution. We have to start with asking our loved ones we have to shift it from what's good for the business to what's good for the residents and our patients. We have to get back to that. And the long-term care places that I see that really have it right, they have that focus 100% on the residents. And as family members and as consumers, we need to kind of put on our, we need to be discerning and seeing, are they putting their profits or their business over the needs of the residents?
Absolutely.
They
are.
And so we have to have a shift of, that's where, so we talk about, we have, with more funding, we have to have accountability of where does that funding go, and making sure that it does go to the specific staff, or that goes to where it needs to go. But we need to, so it just, to me, it's like, and, I hear a lot of industry leaders really rising up and even speaking out, saying, if you're not in this because you care, then just leave our industry, because you're ruining it for everybody. And we need to get back to caring for our loved ones in a way that supports them, and the community. And what, I am hopeful. Last year I'm seeing a huge shift, and you're part of this movement, is people stepping up and coming out and saying, all right, something needs to be done. And I talked to a nursing home administrator last week. I interviewed him for my book, and he left the industry after being in it 10 years, and he's actually, because he just couldn't handle the corruptness anymore, and he's actually going to start his own community in the way he believes that it should be done. So I think there are people that are rising up and saying, we love this group of people. I love this group of people.
Me too.
and they need us. We can't turn our back because it's too hard. And so I think collectively, as we continue talking about it like we are today, we can really promote change. And I'm seeing that happen more and more.
I agree, and I think it just has to be a big. We have to continue to promote that and to encourage that, because I spoke to a nurse yesterday who I was interviewing, who her and her husband, she got out of the corporate hospice, as a nurse because she couldn't take it anymore, and they've started their own, nursing home so they could run it the way they want to, with tender loving care and just doing it the right way. And it's I think taking it back into the hands of the community is really important, because every time you don't you assume that something's being taken care of and it takes it off your plate, then if we're not looking, something's going on, and we've not looked for too long. That's what's happened.
Right.
And so, we put the fox in the hen house to guard the hen house.
Yeah.
Is what's happened.
Yeah, and the pandemic, if there is a silver lining to that, and you talk about, this is what your show is about, is really, looking at the silver lining. And it's number one, it's raised these awarenesses. I mean, our loved ones, your loved one your mom was locked away. You couldn't visit her. And so there was a lot of things that happened as the result of that. And so it's really cracked I think it's really cracked things open, and which is good. It needed that. And, as we look towards the future, the aging population is growing, and we need to improve upon senior care services so that we have the care, not for our parent, for like my parents are entering that, for ourselves. And some people say close all the nursing homes down, everybody can go home. That's not realistic.
Not
so
no.
Home care is an option, and aging in place is an option. And if you can do that, that's great. There's resources. I mean, I'm diving more into that, but that's not a reality for everybody. So we have to look at what we have in place now, and build upon it and improve upon it. And it's going to take a lot of work, and I don't have all the answers. And, it does come from it comes from the top. It comes from political leadership and people standing up and saying that they're willing to make a change, but it also comes from the bottom. It comes from both, right? It comes from us in the field coming up, and it comes from that leadership, the political coming. We have to have both.
We have to have both, but we have to steer our political guidance, because
absolutely,
we need to help steer them. I say we need to shame the hell out of them, but that's not. I mean, honestly, I can't tell you how many people I've interviewed now who have been amazing advocates who have, spent years writing policy and getting it right to the door and getting it passed and passed and passed, and then they get to the door of the governor, and the governor goes and shuts the door.
Right.
And they're heartbroken, and it literally breaks their heart. Like it because no one does this for anything else but because they care. If you're advocating in this arena, you're not doing it for anything else but because you really, really care. And so when those doors get shut, it's so devastating. It's so heartbreaking, and it can be, you want to become. It's so hard not to become nihilistic, because you just think, where are all the good people? Where's the conscience? We need the conscience. We need the collective conscience.
Well, and I think that's
there is, there's good.
Yeah.
No, I was going to say, you said, just a few minutes ago that you love these people, and the people who are trying to make change along with you and Susie and everybody that you love these people. Guess what? These people are us. These people are our kids.
Yes.
These people are the people who are making these bad policies. These people are everybody, because everyone's going there. So, if you think that, I don't have to worry about it for, 30 more, whatever, it's everybody.
Blink and you're there, my friends. Blink and you're there.
It's all your friends. It's your family. It's everyone.
Everybody.
So
and
what are we talking about
And
here?
why are we trying to stay alive longer? I mean, I'm going to, just to be esoteric about it, but it's like, here we are, we're all health conscious, we eat well, we exercise, we think about longevity. It's such a goal for all of us. And yet when we get there, which is an honor, which is a privilege supposed to be, we are devalued. We are completely disregarded. There's bias. If I could hear your mom was 89 one more time, it's like, I don't care about the number. The number is the number. This is a human being. And every human being, it's really a case of humanity.
As if to say she had 89 years of a good life, so doesn't matter.
From here on out, it doesn't matter. The rest of her days do not matter. From here
at
on
least, well, she at least she's an 89. At least she did that. No, well, don't forget that she got, with Alzheimer's, or if you have cancer or whatever, you've been robbed of some quality of life. So you deserve to have as long a life as you want in the best way possible. You deserve that, the quality of life. Everybody deserves that. Some not so much. No, I'm kidding.
No, there's a few who don't.
There's a few. But
well, you're right, and that's really what I see too, and my heart really, that it's the quality, and for me, what I see, and so that's what I'm doing is I'm going at it from the angle of empowering and equipping the healthcare workers. I can't tell you how many times I've had healthcare workers cry with me and say, nobody tells me thank you. Nobody tells me I'm doing a good job. And I tell my staff, like, if all we do is go in and make somebody feel loved today, then we've done our job.
Oh my gosh,
because they just don't get that. And so even as consumers, just going in and thanking the staff. And
oh my gosh,
and
I did that all the time.
So
yeah, I did.
I know.
I used to say,
you
did so good with my mom. You put the cream on her. Thank you so much. Did she love it? I know my mom is very tactile. I would tell them, and they go, oh, your mom. And, and then when you talk to people like that, you disarm them because everyone's on their guard. And
Absolutely.
you have to be a human. You have to be a human. Can I just tell you one of the first things that I noticed when I became, when I realized I had to be there every day last year for the last 6 months. And I remember I was standing out in the hallway and waiting for them to do something with my mom. And one of the women that was a resident there was in a chair, and I could hear her, she was bitching about something. No. So I went over she was in the dining room talking to other residents. And I said, I heard her, and she said, yeah, 3 days. I can't get any dental floss. I've had something caught in my tooth for 3 days. I said, wait a minute, do you need dental floss? Oh my God, I have something stuck in my tooth for 3 days. I go, I can't with that. I mean, I can only imagine if I had something stuck in my tooth, what that feels like, right? I said, hold on. Because I had just gotten I was at some convention where they gave away those things. I got a free one that was a keychain. I said, it's in my purse, but it's locked. I'll go get it. Went and got it, brought it to her, and she said, it was as if I gave her a pot of gold.
Sure.
Right?
Sure.
And she said, can I pay you? I said, no, just don't.
Oh.
I said, this is for you. Don't lose it. But, it's those little things that why? Why no dental floss? Why? Like this is what you pack when you go on a trip. I mean, let's think about the basics of humanity. Right. Dental floss, touching, communication, all those things are so important. And
right.
What we teach our kids, wash your hands. You were outside,
right.
Wash your hands. I mean, but
and they don't cost anything. Well, dental floss does, but all these things don't cost any. How many things do you go through that say, you know what, that doesn't cost anything, that doesn't cost anything, that doesn't, I mean, how many?
Yeah, a lot of it's even just behavioral changes, like I talk about, the way they're cleaning a bathroom. And, look, I was a single mom for a long time, so I consider myself real scrappy. So I come in there and I don't tell them, oh, you need these fancy robots to clean your room. No, I'm like, here's how we can do it with what we've got, right?
Right.
Because, I know that's their number one thing they're always saying is we don't have the extra money. So
You'd be
You know, like
resourceful,
hand sanitizer dispensers, the vendors will put them in the building for free. They do not charge them for the dispensers because you're buying their product. And hand sanitizer is a heck of a lot cheaper than infection of MRSA, you know? So it's like, so I try to, you know, do that as well, you know? So, yeah, I mean, there's a lot of work to be done, but I really do. I just love talking, you know, sharing these experiences because it's giving other people more courage to speak up. And, you know, we can't, for me, it's not just about like pointing out the problems, but it's like, what are the solutions, and get into the solution. And I'm really proud of the work we're doing because every day, I mean, next week I have an infection preventionist doing 9 site visits, and the week before we had 14 done. So every single week we're doing we're doing about 30 nursing homes every month. And I just love that because that's a group of 30 people, you know, a group of 30 buildings that we can impact. And then I'm on national webinars telling, you know, so we're just really trying to impact and penetrate the industry with, first of all, I always come from a space of love and light and, you know, just partnering with them because I know how hard their jobs are, but I want to empower them. And I don't have the power to pay them more to, you know,
Right.
like that's where we need strong leadership to, you know, and coming from the government too, of making some of these mandates as well that support the workers that are in these facilities, because let's nurture them, take care of them so they can nurture our moms and take care of our moms, you know, like that's where it comes from.
It does. And I don't think that saying, you know, it takes a village could be any more appropriate than in this arena, because it really does take a village. Even as a caregiver, you have to
Sure.
see, like what you're doing is you're sharing the perspective of the front line, so that when we go in, and listen, it took me a while. I mean, I'm a pretty friendly person anyway, but I realized it was important that I really express how appreciative I was when someone was really doing a good job. I wanted them to know it, and I think that we need to do it. We all need to be acknowledged for what we're doing, and it motivates us. If we're being beaten down all the time, like, you know,
Yeah.
that's not gonna create a better situation for your loved one. It's not. You know,
Right.
and
Well,
it is.
for the care, I mean, for the care staff there, if you're working in an environment, for example, you know, we know that they're completely underpaid. They need to be paid more. But that said, if you're working in a loving, wonderful environment, and it's a lot easier to, you know, I'm not saying they shouldn't be paid more. I'm just saying the fact that they're not paid enough and they're working in horrendous
Right.
conditions.
It's not rewarding
Which
in
makes
any way.
it's not rewarding. It's harder on everybody. It's harder on them. It's harder on the patients or the you know, it's
The residents,
it's absolutely it's a lose everywhere. And if you have, as thinking of the administration, if you have a happy staff, it's a lot easier to say, okay, I'm, you know, whatever. And I'm thinking from their point of view, there's this dollar bottom line. It's a lot easier to say you're getting a 50-cent raise instead of a 75-cent raise. If they're happy, you know, it's beneficial.
Yeah.
They should be getting way more. But we got to change that entire environment.
You
know,
do,
when we'd walk in to visit Susie's mom, and this is because, you know, she was an advocate for her. Most of the staff, you know, they seemed miserable. They seemed, you know, and this was at a 5-star facility. This was at a great facility, quote unquote. It just doesn't make sense in any level to have this horrible working environment.
And I will tell you, it's not just about the money. You take anybody working in long-term care, and if they have a happy environment, they will take that over a few extra bucks any day. They're not there for the money to begin with. That's the thing.
Yeah.
But let's respect them and
Agreed.
pay them a living wage, and then also create not one or the other, but let's have both.
I
you know?
agree with you. I was just going to say, like, the system, yes, this is why I'm doing the documentary. It needs to change 100%, like tomorrow. But in the meantime, what you're doing is going in and helping create some kind of, you know, peace and a better result for everybody. within this system.
Right.
We're in. This is the situation we're in. How can
Right.
we, what can we do now? Like you said before, and that's what's so important because, and that's where, as a caregiver, if you can, it's important to realize. So everything you're saying is if you know, you do better. If you know, right? So
Right.
in knowing, you're telling us what goes on in there. So we need to be cognizant, because I didn't know that. This is all me learning on the trot. Because
Of course.
how would I know?
Yeah.
How would I know? You think, you see somebody in a white coat and you think they have the power. They don't.
You trust, and you trust because they put on the uniform, whether it be this, whatever their way, and you trust. You think they know. You think they're there to do the best for whoever's there, and most
They're
of them
people.
are.
They're human
but
beings
they're
too,
just
and
human
they're
beings
going
who have
through
bad
it.
days, and yeah,
They're
so
human
you got to make the best
beings.
environment possible. So.
And they're dealing with this system too. So nobody's loving the system except
Absolutely.
for the people that
Yeah.
are getting money from it. Nobody likes it. Nobody.
That's
they're-
true.
Nobody
they're
is
victims
going,
of it
this
also.
is great. Nobody is. Nobody wants to see a vulnerable person.
Nobody went into that business. Nobody who went to
No.
do, like you said, they're not there for, they did it because they care. And then you get to the point where you hear people either dropping out or they just don't care anymore. They
And
can't,
listen,
they're beaten down.
Can I just say something too, just an addendum to that? Yes, there are bad actors. There are bad people everywhere.
Yeah.
When a situation like this is so, and I know it is surveyed, but not to the point that it needs to be. It's surveyed in places that it doesn't need to be, like you said, like the record keeping and all these regulations. It needs a different kind of oversight. So in that case, it gives a lot of leeway for bad actors to engage in bad behavior. That's not the that's not the norm, but does happen, and those are the things that get, those are the things that get the notice. Those are the things that get the news, to say, oh, this,
Right.
and I'm not saying it doesn't happen. It happens a lot, but sexual abuse and those kinds of things that happen in these in facilities. Yes, it happens, but I think it happens. Not the majority of people that are there. Those are the bad actors that happen to end up there, and they're the outliers. They're not the norm, but they get a lot of attention because they slipped by because it's easy to. It's easy to, and it's and there's vulnerable people. It's like, unfortunately, when children get sexually abused because it's easier because they're vulnerable,
Right.
and you don't just don't assume. You don't assume, oh, we're in a medical situation. That would never happen. It happens, but that's why there needs to be
Right.
better oversight. So, but for the most part, like what you're saying is, people are there because they want to be there because they love what they're doing. They're vocational caregivers, providers.
They're caregivers.
Yeah.
And they have the heart for it, but if you're not supported as a caregiver, then it's going to it'll just chop you down at the most basic fundamental level of who you are at your core. And so what are you going to do? You're going to try to go somewhere else. That's why the turnover is so high. You're going to try to go somewhere else that fulfills that, and and you just keep looking and you keep looking, and then eventually sometimes people just leave the industry because they're like, it's
Yeah.
just not possible. So,
And
that's
the moral,
why I
like
say,
the moral injury, like you said, the moral injury is horrible.
right. Yeah. So, I think that, just we've got to invest in the workforce. I've been speaking a lot about that lately, and there's calls for more funding for survey and oversight, which I support regulations. We need regulations. If we don't have regulations, then things will go to the opposite extreme. We need more collaboration and help too, so more people like me can come on site. The hardest part about my job. Now, the work I do is free for the nursing homes. They don't even pay me. It's funded through CMS. The hardest part about my job is getting in the door, because people don't trust that when I'm there, that they're then going to get in trouble, no matter what. no matter what.
I saw one of your videos I saw that in your video that you post on your website.
And you know why? Because they know that it's not right. They know what the practices that they're doing are not right.
No,
Otherwise
it's not just that. No, it's not just that. It's just the industry. It's such a punitive. Like there's so much. It's so punitive in the sense that it's that nitpicky culture of what I'm telling you too. Of like there's not a supportive environment either.
Right, but
it's not supportive.
But the punitive, the aspects of punitive nature goes to the front line. So that's why it doesn't.
Right.
Those punitive, the punitive actions that happen don't really affect the upper tier. That's just cost of doing business. They don't really care, and all they're going to do is the crap is going to roll down the hill, and they're going to be, it's going to be like, hey, you guys screwed up. And they don't really. They're so far removed from it that they have no idea. It's like running a restaurant, over the telephone, and just like they're not there. They don't know what goes on. They're not in the trenches. They don't understand it.
But we need, as we said before, we need different regulations. But I think the punitive part of it isn't enough. Meaning that when these companies are really doing bad things, they're not being punished enough. They're not. There's no. It's like it's water off their back.
That's what I just said.
No, I definitely. I see what you're saying. I mean, there are definitely those situations that occur, and then the opposite side of that is then to show that it is working. Then you might give a citation to a building that like I talk in my book. One facility was cited because the nurses didn't disinfect their pens after sharing it, or something like that. So then it becomes so ridiculous that then the whole survey process becomes ridiculous, and so it's not really effective in what it needs to do.
No,
so that's
so
what
it's
I'm saying.
optics.
That whole,
it's optics. Yeah. It's basically they got to find something, so they'll find that. Right? And again, the low hanging fruit. So it's like, let's do this, and it's stupid. I mean, just as a consumer, I mean, Dawn and I would go to visit my mom, and sometimes we'd go there and we'd have to, they had to sign in, and you had to sign in, and you had to bring your test results, and you had to temperature, and you had to put the gloves and this and everything. And then sometimes we'd walk in, and there'd be nobody there. We'd just walk in. It's like five-star facility, folks. I mean, so where's the consistency? Right? So, and if it's happening there, it's happening everywhere. And that's the problem. And it is too much for the front line to handle. It's too much responsibility. It's too much. Because
their job is to deliver quality care to the residents. And they,
full stop.
They do not need to be dealing with all the other, trauma that they do. So,
agreed. I agree with you. Yeah. You're doing such a good service. You're doing what you're doing is so important. It really is. And it's extraordinary, and it's really basic, and like, I can't believe that this program just started, basically. It just seems so.
Well, and my thing is, like, we have to really advocate for funding, to keep doing this work, because I say, like, we need to do more. We need to do more of this, but we need funding, and because the nursing homes, they don't have the funding to pay for this, and so we need more support to help them as well.
Where would that come from then? Where would you see
the government?
It coming from? Okay.
Mm-hmm. The government. Yeah.
Okay.
From
so that's
CMS.
Yeah. That's a challenge.
So CMS.
Well, but CMS has, they have certain budget for nursing homes. I know there's been, talk about rolling that back, but that's why I'm always, trying to say we need more support. And that's why I always say too, like, if you put it into organizations that can help support too, and then, like, for example, the facilities that I talked about that get to work with us for 30 facilities that get to work with us for a year, like, that's going to be major data driven. We're going to be looking at how their infections decrease. Like, we can look at how this funding is doing good, and we can show that.
That'll be
and we can
huge.
show the improvements.
Yeah.
You know.
Because if you have numbers like that, it's like, where businesses, when somebody first came up with maternity leave, they're,
Right.
oh, I can't, that's going to be expensive. And then finally, when you show how it actually benefits the company and benefits everyone, then suddenly there's maternity leave. Then there's paternity leave. It's
Right.
getting those figures and showing the real life,
Yeah.
use of it that can change things in the long run, hopefully.
Yeah, absolutely. I mean, we have to, demonstrate that we're demonstrating that working collaboratively, not just in a punitive sense, is helping them and, can go a long ways. Because even like currently so for example, if I'm surveyed and I get a tag or I get a deficiency, I have 10 days to fix that, to show the state that I'm in correction. Well, if you have something that's deep in your culture, you're not going to fix it in 10 days. I mean, you can show it on paper all day long, but guess what? After 10 days, everything's going back to the same way.
Yes.
So, that's why I'm a huge advocate. We need time. We need time to get in there and work with them and change the culture and provide the education. And we can't just say, oh, in 10 days, fix it and you're good. It doesn't work that way.
I think they're being directed, though, to do that I'm talking about not nonprofit. I'm talking about, the for-profit facilities. It's basically, everyone's shackled, by, just get it done, just check off the
Well,
boxes.
they have to. They have 10 days. Yeah, 10
so
days.
they have to do it.
Right,
So-
they have to, but what I'm saying is that's not sufficient.
It's not sufficient, but, yeah. So in the meantime, you're right. You guys need to be in there more. And pick up the slack where they can't because of the culture that they're in.
Yeah,
And
we can say you have to show, like, if you have an immediate jeopardy or you have something that is causing great harm, yes, you show that that's corrected immediately. But then, or I should say, not but,
Yeah.
you show that that is corrected over time and stays corrected, not just we fixed it 10 days and we're done, we're clear. No, let's do it for another 6 months or a year and make sure that
Really
is not
implement
occurring
it.
anymore.
Right. Really implement it.
Yeah.
Makes sense. So again, your next book, do you have a name for it yet?
I've gone through several names. I'm thinking The Bridge and Successfully Navigating Senior Care.
I like The
that's
Bridge.
what's sticking right now.
Mm-hmm.
Yeah,
I always
'cause
say
it's
that I
kind
walked
of-
my mom over the bridge, so that's a good metaphor
Yeah.
for me. I like it.
Yeah.
I like it. It's
But,
very poignant.
Yeah, and I've done a lot of great interviews. I just get so excited when I hear, I learn what people are doing, and they're
Yeah.
really doing some great work. And if we can highlight that and showcase that and give our loved ones options. So I'm also wanting to create like a workbook with it so consumers have, more, they can take notes and they can, really have something to something to use as they document their journey. But I dive deep into like the 5-star process and is it really 5-star, and really exploring how to find the right place and the right questions to ask. Well, Susie, on CMS website, in the very first paragraph, it says, do not use this as a, this is not what you should basically determine.
Exactly.
For the
Isn't
quality
that
of
sad?
care. So,
Isn't that sad? They have a rating system and they have to have a caveat for it.
Right. Don't listen to it. Don't really pay attention to it. It's,
Yeah, if 5-star-ish. It's terrible.
So I think, after talking to you so much and just realizing like we have to follow our intuition, we have to talk to people, we have to, I talk a lot about our own advocacy for our loved ones and, like how we really take care of our loved ones in this situation and not just kind of get pushed over, too, and just the importance of how we can support our loved ones in this situation. But we do need solutions now, and I am seeing them, And it's really cool.
Yes, there are.
They're there.
I agree.
They're out there.
They are
They're
out
And
there.
you're providing them.
And definitely going to highlight that in the documentary, because I don't want people to think it's, this is a exercise in futility. It's not. And listen, there's very big voices that I've interviewed that said it's not going to change. I'm here to tell you it's not going to change. And I say, you know what? Yes, it can. Yes, it can. It's not going to be easy, but there's, we've made bigger changes.
It's already changed. It's already.
That's what I was just going to say.
Right
it
now.
is changing right now. Yeah.
But
and you have
there's
strong leaders. You have strong leaders who have said, look, I still want to be in long-term care and I still want to care for this population. So I'm going to go do it a different way over here. And those best practices will start to pick up speed. They will.
The models are there.
It's just going to take time, But I say, to people say, oh, it'll never change, or we should just close all nursing homes. I'm like, well, what's that? We can't. That's not our solution, because we need people today need this level of care. We are not a society that has raised up our families to where we're all living in the same household and we care for. I mean, we just don't have that. Some communities do, but overall, that is not our culture.
Because we also need to shift our perception and perspective on our elders and how we view them ourselves, because they're also, societally or socially they're dismissed, they're disregarded as and we've grown up like that, to think that way. It's like, youth is good, I'd rather die before I get old, and all that kind of stuff. It's like, we just don't think. I mean, I saw it so much in the homes or the facilities. When I visit my mom, I see it, I saw it. It's painful to watch. It's painful. Right. So,
no one would say close the hospitals.
Right, exactly.
It's like, but let's close the nursing facilities.
Because it doesn't matter.
Because there's problems. It
well,
doesn't matter.
They're
really,
dying anyway. They're dying.
Yeah.
I'm going to leave you with this nice little story, this anecdote that this awesome Michael Broska, who's this elder care lawyer who does it because he cares so much. And he says, if I can change one family and make them feel a little bit better, it's never about the money. And I said, how do you do it every time? Like, how do you get up and say, I'm not going to really make a change, and he goes, well, and maybe you know the story, people out there, but I think it was so lovely. He said, do you know the story about the starfish? And I said, no. And I said, tell me. And he said, well, there's this grandfather and his grandson are walking down the beach, and there's waves coming in, and every time a wave comes in, it brings in a starfish. And the grandfather would bend over, pick up the starfish, and throw them back in the water. And Ed kept doing that over and over. And there was like hundreds of them that would get washed up. And his grandson said, Grandpa, why do you keep throwing one back in? There's so many of them. What's the point? And he goes, it doesn't matter. He goes, well, it matters to that starfish. And that's all we can do. So we have to start with one starfish at a time, because it matters. It matters.
Absolutely.
And if we all throw one starfish back, wouldn't that be cool? I don't know. I'm just saying. I think it's, we have to get back to simple thinking and really realize that these are human beings, and it does matter.
Right.
So, because we love them, and why do we always say that, Don? We love them.
We do. We love them because, as we all know, that love is powerful, love is contagious, and love conquers all. So we want to thank our guest, Dr. Buffy Lloyd-Krejci. And definitely pick up her book. We'll have all the links in the show notes. Please subscribe to us, and please definitely check out the opportunity to be a part of our movement with No Country for Old People. There's no dollar figure too small, and if nothing else,
National Consumer National Consumer Voice. Go to their website.
Definitely. And we'll have
Dr. Buffy's going to be in our documentary.
Website
so
up there, URL. She's going to be there, and as you can tell from this, she's going to be an important part of it. So
very important. Thank you, Dr. Buffy.
Thank you for watching and listening. Thank you.
Thank you, everybody. Have a good one.
All you gotta
my
do
pleasure.
is sing a song.
Bye bye.